Hi, Dr. Dan Purser here. Tonight we're going to do our second Facebook meetup. This one is going to be on progesterone, how it can benefit women in general, not just women in menopause. I'd like to do some housekeeping first. Let me explain Thunderclap because a lot of you have asked about it. Thunderclap is a social media sharing concept that's getting huge. And when you want to get a message out that's really important or a health message that you want to share with the public, it's a great vehicle. It's just like imagine when you hear thunder, the thunder clap as it rolls across, goes miles and miles and miles in mere seconds, how helpful it is to realize how far away it is. Anyway, that's the way social media sharing through Thunderclap works. It's free to do. Right now I'm doing a Thunderclap for MTHFR, and I've had this #1 book. It's free right now to download. That's why I'm doing the Thunderclap for people to get it free. We're trying to share the message on MTHFR, how it can benefit people who are dealing with it. How free book, you can't beat it. How it can help educate the public on MTHFR. We think that probably 75 to 80%, maybe higher, of young living distributors, for example, might be carriers or have the actual homozygous disease of MTHFR, or error, I should say. So it's an interesting concept. Please share it. If you see it on my Facebook page, just click on it. It doesn't cost you anything. It's super easy to do on my wall. Next month, we're going to start a Thunderclap on women's health benefits and progesterone. My progesterone book is going to be free all next month, and so both in the English version, the American version, I guess, the Japanese and the Spanish version are all going to be up for free on Amazon. And so we want to start a Thunderclap educating women on progesterone benefits. And tonight we're going to talk about some of those benefits. Actually, tonight we also launch the progesterone course again, the menopause course for anyone who didn't get it the first time. You can grab it now, and you'll see the website come across the screen here, the URL that you can click on. And so if you're interested in taking that course, it's me educating about progesterone and the benefits, how it can help women. So let's ask questions. You can just type them in, send them to us, and we'll go through them. And Denise is going to help read the questions to me tonight, and I'll just answer them. So Denise, make sure you speak loudly enough so they can hear you. And let's start.
Okay, your first question. Does natural progesterone help with fertility or getting pregnant?
Yes, natural progesterone does help with fertility and getting pregnant. It is the progestational hormone of pregnancy. If your progesterone level is not adequate, it's very difficult to get and maintain a pregnancy. And so it can be a problem with getting pregnant. I've gotten hundreds of emails from women who've tried natural progesterone and gotten pregnant and conceived and went to term and delivered healthy babies, just thanking me for educating them on progesterone. So it definitely does help.
Okay.
Was there any other housekeeping that we had to do?
Yeah, you need to take care of some housekeeping real quick.
One other housekeeping thing that I just saw come across. I want to be really clear for all you young living distributors. Progestence Plus, there's a rumor going around that it contains wild yam molecules that convert to estradiol. It does not. There are no wild yam molecules in Progestence Plus, though it's derived from that originally. There's not even a molecule of it in there anywhere. It does not convert to estradiol. I posted something about that this morning. Just tell all your friends it does not convert to estradiol. It's safe for women. It's very safe for women who've had breast cancer to take, or for any woman who's worried about estradiol, they can take progesterone. It's set to balance the estradiol levels, actually. So, okay, sorry. Just wanted to make that point. Go ahead.
Okay, that was great. You answered Bernice's question, so yay, Bernice. Now, Becca, is Progestence Plus best for daily use or as needed?
I don't know. It's according to where you're at. If you're postmenopausal or perimenopausal, I would use progesterone daily. If you're premenopausal and you're PMSing, I would use it as needed. If you need it for the 4 or 5 days before your menses starts, it's perfect. Natural progesterone is a wonderful option for those kind of things. Keep company names out of this.
Okay, got it. Number 2, can you use natural progesterone after you conceive? And why would you use it?
Can you use natural progesterone after you conceive, and why would you use it? Yeah, it's done all the time. The OBGYNs will use progesterone injectable shots, progesterone in oil they call it, injectable shots. It's to maintain the pregnancy, the viability of the uterus, and for women who can't mount an appropriate progesterone response. I think there's easier ways to take it, either as a capsule or as an RDT, a rapid dissolved triturate. This is probably the best way to take it, but it's a lot easier than those painful shots. And OBGYNs use those quite commonly, actually. And so a lot of women have done that. Safe to use through the 10th week of gestation even. It's safe to use the entire pregnancy, actually. At the beginning of pregnancy, your progesterone level your blood level might be 10, 11, 12, 20 maybe, but by the last day of pregnancy, it'll be 900 or 800 and something, or 1,000 even. It can get really high. Progesterone levels get really high, and that crashing back down to normal levels of the progesterone is why so many women get postpartum depression, actually, or postpartum blues, as they call it.
Okay, here we go again. Does natural progesterone cause cancer?
No, natural progesterone does not cause cancer. It started back in 1981. The American Journal of Epidemiology published a great review article where they looked at all the studies on natural progesterone. That was 1981. A really well done review. And what they saw was that natural progesterone, when your levels are normal with natural progesterone, you get a 500% decrease in breast cancer risk. Wow. 500+% decreased risk of breast cancer risk, and 1,000% in all cancer risk decrease overall. It's huge. You want to maintain as best a progesterone level as you can. Studies have shown it decreases cancer risk dramatically. It has never been associated with causing any breast cancers either. Go ahead.
Okay, this is from a man.
Let me
Okay.
add something to that last answer. Doctors often say that it causes cancer because you're confusing synthetic progesterones or progestational agents with the natural progesterone. And the synthetic progesterones, like in birth control pills and medications like that, have a 220% at least increased risk of breast cancer when you take them. No decrease. Well, the natural progesterone decreases your breast cancer risk. Okay, sorry. Go on.
Okay, some teenage questions here, or young women. Does natural progesterone help with PMS and help with migraines? Why and how?
Natural progesterone reduces vascular inflammation. That's how it helps with migraines. Helps prevent migraines. Is it perfect? No. Does it help all migraines? No. But a lot of women's migraines get better, especially the PMS kind of migraines, the cyclical kind of migraines that occur, the hormone migraines that they get once a month. It's because they're not mounting an appropriate progesterone response. And yes, you can get rid of your PMS if you take enough natural progesterone those 4 or 5 days before your cycle starts. Next question.
Okay. Can the human body convert wild yam to progesterone or estradiol?
No, it can't do it. It's missing some enzymes that don't allow it to happen. I know that's a big concept out there. And so, no, it won't do it. I wish it would, but it doesn't. Be neat. That way, women all over the world will be eating yams every day. And around Thanksgiving, a lot of women would not have PMS. But trust me, as a physician, I've gotten tons of calls when I've been on call for Thanksgiving or Christmas, and they've eaten a lot of wild yams, but has not gotten rid of their PMS.
Okay, I am 72 and still hot flashing and can't sleep. I wake up drenched. What would you suggest?
Well, she's 72. She's still hot flashing. She wakes up drenched, and she can't sleep. I'd suggest natural progesterone first and foremost. It's got a probably 95% chance it would work. And it would, she just needs to take enough to help her get to sleep and to get rid of her hot flashes and night sweats. And I would probably use an RDT or a capsule to begin with if other options weren't available. And most of you young living distributors know what the other options could be. I won't say beyond that. Yeah, there's all kinds of progesterone options that can help that woman. She should take advantage of it because it will reduce her risk for breast cancer, among many other things and other forms of cancer.
Here's another one. My doctor wants to now put me on birth control pills to regulate my period. What do you think about that?
A lot of doctors have the misconception, especially younger doctors, that birth control pills will help regulate the period. It doesn't. It just shuts it down completely. But it does allow you to hemorrhage once a month out of your uterus, which is an interesting concept. But it's just a hemorrhage. You're not cycling. You're not doing anything. You're just having withdrawal bleeding and hemorrhaging. At the price of increasing your risk for heart attacks, strokes, that's a 240% increased risk, if I remember right. Or breast cancer, which according to your age can be anywhere from 500 plus to 220% increased risk for breast cancer. It's not worth it. Strokes are a big killer. Heart attacks are the number one killer in women, and a lot of women die within a month or two after they get on birth control pills because they can't tolerate them. So I wouldn't do it just to stop bleeding. I'd use a natural progesterone.
Okay, I'm 23 and I hot flash. Why? What can I do?
Some women, she's 23 and still in hot flashes, which is a little unusual, but I've seen so many of these cases. Some women hot flash or a severe PMS, or they night sweat, and they're in their 20s or even in their teens. And I know doctors want to put them on birth control pills. I would say use natural progesterone instead. It's so much safer, so much more effective, and so much better for that woman. So I'd give her a natural progesterone. The reason she's probably doing that is because she's not mounting an appropriate progesterone response right before her cycle begins. Women's progesterone levels should go up pretty dramatically right before they start, bleeding. They start cycling, and some women just don't do that for whatever reason. It's either a genetic thing, or they've had ovarian damage, or they're malnourished, or who knows what. They have a vitamin deficiency. Maybe they have MTHFR, genetic error, which can cause, in and of itself, a form of malnourishment. So it can be a problem. So they got to use natural progesterone.
Okay, this is the next question. Are there any prescription or big pharma meds that are actually natural progesterone?
Are there any prescription big pharma meds that are actually natural progesterone? Yes, there's one. It's been out a long time. Most doctors kind of vaguely know about it. So if you have a doctor, say you're in North Dakota and you can't get natural progesterone, and by the way, this meetup isn't just for my young living friends and other distributors, but it's for the general public too. And you can't get natural progesterone. You can't get your doctor to prescribe it for you. You can ask your doctor. You can trick him. You can ask for a medication called Prometrium. Prometrium, Prometrium, which comes in a 200 milligram capsule. That's what you'd want, not the 100 milligram capsule. And you take it right before bed. I'd go for 2. Most insurance companies will pay for 2 of those. It does give you another option, and it is natural progesterone, and it's made by Big Pharma, which is really weird, but it's been out for about 50 years, and they've been using them. It's in the PDR. They actually came out with a generic finally about a year ago, which is crazy. It took that long to come out with a generic, but it's really effective. Next question.
Okay. This is a good question. Since synthetic hormones and birth control pills increase risk of cancer, is there a bioidentical hormone birth control pill? What's the healthiest form of birth control?
Wow, so the healthiest form of birth control the healthiest form of birth control period. Just not a lot of good options. I prefer, if a woman's already had children, I would suggest a copper IUD. I don't like the Mirena because it does have norgestrol on the tip of it, and which has been shown to cause breast cancer. The problem with Mirena's, the study they did that got it passed through the FDA, and that's listed in the PDR, you ought to read it, get a PDR at the library and read it, is a 1-year study. Even if all the women were developing breast cancer in the study, it wouldn't have shown up within a year even. So Mirena is considered safe by most doctors and not associated with breast cancer. I will say that, and that's what the FDA thinks too. It's up to you to decide on that, I guess. But so I'd probably use the copper IUD. If not, you're probably going to use condoms or foams or a cup or something. There's just not a ton of good options. But that's what you got to deal with if you don't want the risk of breast cancer and strokes and heart attacks from birth control pills. Remember too, anyone with MTHFR, which this book is about, has a really high risk for having a stroke or a clot, a blood clot, or even a heart attack when they take birth control pills. Women who have MTHFR cannot tolerate taking birth control pills. Most of them have real problems with the birth control pills. It makes them feel anxious or crazy or depressed, or they get a lot of inflammation, and a lot of them have strokes or clots or heart attacks from it.
Not to mention themselves, personal questions.
Oh yeah, don't mention yourself in the personal questions, please. Please, I don't want the FTC or HIPAA violations or FDA or anything like that coming down on us.
Okay.
I hope this is helping so far.
Is there a good bioidentical progesterone?
Is there a good bioidentical progesterone? Yeah, there's a ton of them out there. You can go to a compounding pharmacy near you and talk to them personally and ask them about if they can make an RDT, rapid dissolved triturate. That means they're pretty knowledgeable compounding pharmacists. If they're just into the capsules, not so much. Creams, let me be really clear, creams have not been shown to be that effective, if at all, especially after 30 days. If that cream's been sitting there for more than 30 days, it's not going to work. That's from a number of really well-done studies. Probably the best way to take it is through possibly a serum, I won't name anything, or through the RDTs. That's clearly the best way. Those are rapid dissolved triturates or troches that you put under your tongue, and you dissolve them at night. And I have patients who, say, have progesterone resistance, which is a common problem. 1 out of 100 women have it, so I guess it's not that common, but I have like 9 of those patients, and they take 15 of those 200 milligram progesterone RDTs at night on average. It's a lot, and it works really well for them. Gets rid of their endometriosis, gives them a normal life for the first time. So there's lots of good options, and so you just got to test them out. Probably the nation's largest compounding pharmacy, I think, is MedQuest up in northern Utah. They're really good. And there's just a number of good pharmacies around that can do this. So check locally first, see what your doctor will do. Talk to the compounding pharmacist. Maybe take it back to your doctor and say, hey, this compounding pharmacy can make RDTs. Can you prescribe me some 200 milligrams? I want to try 1 or 2 at night and write for 60 of them or 100 or whatever he'll do. He or she will do, and try them. And anyway, if you get my little progesterone book, which I said I'll be free on Kindle next month, you can show them that and say, this stuff is totally harmless. It's beneficial, actually. It's vitamin P for women. But that's progesterone, not Perser. So, okay.
Okay, so many good questions. Okay, this is kind of interesting. A 16-year-old young woman had childhood cancer. She's a survivor, and she's in ovarian failure. The endocrinologists have placed her onto estrogen patches and progesterone tablets the first 10 days of the month. Is there natural therapies we could use instead of these? Do we have options?
First of all, those both sound like natural therapies. I would think, I don't want to question what her doctor's doing, so I don't want to step on their toes. Actually, they sound like they're doing a fairly good job of that. I'm surprised they're doing as well as they are. Good guys. Whoever you are out there, you should hug your endocrinologist. Wow. I think oral estradiol is more beneficial for women for a number of reasons. It prevents breast cancer. I didn't mean to say that. It prevents heart attacks, strokes, and diabetes, which topical estradiol won't do, or estradiol cream or patches won't do. So that's a huge benefit of oral estradiol. And she should continue the progesterone tablets. She should, yeah, they sound like they're on the right track. Those are all sound like they're bioidentical. So unless I misunderstood.
Okay, here's another one. Why does natural progesterone make my breasts tender, larger, more full?
Natural progesterone does tend to. That's kind of a running joke. I'm in a cosmetic surgery group, reconstructive surgery group, and instead of breast augmentations, my patients get larger, fluffier breasts when they take progesterone. It's because it kills fibrodense breast tissue and wipes out premalignant breast cells, breast cancer cells. So natural progesterone is awesome, but it will put your breast through some tenderness for a few months while it's making those breasts lighter, fluffier, and larger, and taking care of the fibrodense breast tissue. It's how it reduces your risk for breast cancer, because it kills the fibrodense breast tissue, which is a breast cancer risk factor actually, or the premalignant cells, and that's what hurts.
Okay. Why do birth control pills make me angry and my weight go up?
Why do birth control pills make this lady angry, and I assume it's a lady, and her weight go up? They're very androgenic. Also, maybe she has a genetic error like MTHFR or something like that, and it's just probably not a good choice for her. I would, if she were my patient, I'm not going to tell her what to do, but if she were my patient, I'd probably say, wow, let's stop those bad boys and try you on something else, or use condoms, or use, which I know are very, very enjoyable, but and a little problematic, but use cream, use foam, let's do a copper IUD, something else. Give her another option that's more palatable.
Do postmenopausal women need progesterone?
Yes, it's a common misconception. Do postmenopausal women need progesterone? Yes, they do, because it reduces the risk for breast cancer. The peak age for breast cancer, peak age is 65. Anything you can do to prevent breast cancer around that time helps, and progesterone lowers your risk dramatically from breast cancer. It also helps with sleep, prevents night sweats, hot flashes. And so I see so many women who are 60 or 65 or 70 or 58 who come in my office and go, I am hot flashing, I'm night sweating, I have migraines, I am sick as a dog, I'm so tired of this, I can't sleep, help me. And we get them on natural progesterone, and it changes their life. I also will consider starting them on some form of estrogens at that point too, because once you balance it with progesterone, estrogens are really safe usually. So we'll get to that in a couple of weeks and talk about that more. But yeah, I would give her natural progesterone. The other thing that doctors do a lot of, if they do a hysterectomy on you, they say you don't need progesterone. I don't know where that comes from. It's not in the literature. I just think it's a misconception out there. You still need progesterone. Just like that 16-year-old girl we talked about a minute ago still needs progesterone. If someone removes your uterus, it doesn't mean you don't need the hormone. It's like if your pancreas is gone, you don't need insulin anymore. It's kind of weird. It doesn't make sense. So maybe that's not the best analogy, but close enough. You still need progesterone. You still need estrogens. They're so beneficial and so protective. So yes.
Did you want to revisit the wild yam thing one more time? There's a lot of questions.
So
You can tell them to go back and watch the video.
Yeah.
yeah, go back and watch the video, guys, on the wild yam. Wild yam, we don't readily convert it into progesterone or into estradiol. I don't know where that rumor comes from. Someone sent me an article or research that's been validated and peer reviewed, and if it is the case, I haven't ever seen it. And in progesterone products, especially those made with pharmaceutical FDA approved progesterone, there will be no wild yam molecules, none, zero, zilch, none. So that rumor needs to stop going around. That's just a misconception, and it's just a rumor. It's just there's no truth to it. Sorry for raining on that parade.
Okay. Does natural progesterone cause weight loss?
Yes, natural progesterone lots of studies have shown that for the vast majority of women, it causes weight loss. Yes, there's some women that gain weight with it. I don't know why, but that goes against the grain because 98% of women lose weight when you normalize their progesterone. They sleep better, they feel better, and they start dropping weight. If they're using a lot of progesterone, it may cause some weight gain, but they have to be using a lot.
How does one know if they're getting enough progesterone?
That's a great question. How do you know if you're getting enough progesterone? Let's say you're postmenopausal and you're hot flashing, night sweating, and you can't sleep, so you just take one progesterone rapid dissolve, triturate at night, and you sleep pretty well. Your hot flashing night sweats are mostly gone, but you're still hot flashing and night sweating during the day a little, and you can't figure out why. Well, up it a little. Up your progesterone RDT, maybe try 1.5 at night or 2 at night, or maybe use some topical product during the day to help get some relief. You'll know if you're using too much, if you're sleepy or drowsy all the next day. Now, a question completely outside of this, a young living distributor asked, is why is there wild yam on the label of Progestence Plus? It's because it's a marketing move, and it's smart. The original progesterone was derived from wild yam, so that's where it comes from. So, but there are no molecules of it that come through. So, but just mark it out with a magic marker because there's no molecules of it in there.
What does progesterone do for the thyroid? Does it?
I don't know that it does anything to the thyroid. I haven't looked at the literature on that. What does progesterone do for the thyroid? I know this, the thyroid hormone and the thyroid gland helps to a certain extent control the ovaries or the testicles in men, and helps if your thyroid's low, like several major naturopaths and endocrinologists say. Gary Young says it, and other people, if you don't deal with your thyroid issues first, you're going to have a lot more problems downstream, such as with your ovaries or your testicles. So I would say it's reverse that. It's your thyroid controls more of your progesterone output.
Here's a good one. Can progesterone help with widespread pain, inflammation that increases during a premenstrual cycle for someone with Lyme or rheumatoid arthritis?
Can progesterone help with widespread inflammation during the menstrual cycle for someone with rheumatoid arthritis or Lyme's disease? Yes. Progesterone is very cooling. That's how it helps with migraines and other issues in joints. Like it's my treatment of choice for temporomandibular joint disease, or TMJ as they call it. It'll almost always get rid of TMJ. It definitely helps with inflammation in the hands and the feet and the joints. And I've heard that 1,000,000 times from women who are taking it. So yes.
So on BHRT, thoughts on pellets or cream?
So on bioidentical hormone replacement therapy, BHRT, thoughts on pellets or cream? It varies. I think I've never used a progesterone pellet. I know they're out there. I know we could in our office. We do use pellets for testosterone, for example. But I think women like to control their choices a little better, and they prefer to use like a testosterone cream. I don't use a progesterone cream. I've not just found them to be beneficial when you have such other more powerful tools. And some of them you're very familiar with, some serum products and other things that are out there that are really good. And also the RDTs and the troches and the capsules that are out there. I just haven't depended on progesterone creams ever.
Progesterone while nursing, yay or nay?
I get asked that question a lot. I don't think there's a problem. I think you can use it while nursing. It won't dry up the milk.
Here's another one. Head sweating, a sign a senior needs progesterone?
Say it again.
With head sweating, is this a sign that a senior, so probably postmenopausal, needs progesterone? I know you already answered that, but that's it.
I would think I would try it at least a small dose at night to see if it can give them some relief and help them. It's totally safe to give them at night. So what it makes them sleepy. Anything we can do as we get older to sleep is just a godsend. So it's a natural way to help a woman sleep. I'm assuming they're talking about a female senior. So the only time I'll use progesterone in men is if they have MAOA, they're homozygous for the warrior gene, as it's called. A small dose of progesterone is very helpful for these men, and take it at night, lets them wind down and go to sleep, because the MAOA causes a lot of anxiety if they have the homozygous genes for that. So,
I have another question.
so we've been asked, is PP, that's how I'm going to call it, still a good product? Well, it's a great product. It's probably one of the best products on the market for to use, that anyone can buy. It's a super good product. So yeah, it's not a problem at all. It's still, I think 12,000, 15,000 women a month use it and love it. I still get tons of emails on it. So yeah, it's a great product for all you young living distributors.
Okay, thank you for all the positive thoughts on PP, everybody. Okay, here's a good question.
We love PP.
We
I know
love
it's
it.
very popular, and I'll just leave it at that.
Okay, on topical progesterone, a lady is taking 20 milligrams a day and still having symptoms of estrogen dominance, insanely heavy, painful periods. Question mark, question
So a
mark.
lady is taking 20 milligrams of
Topically.
topical progesterone a day and still having symptoms of estrogen dominance. She should. Heavy periods and all that. Topical progesterone, meaning a cream, doesn't work. Serums, we think, are the best way to go if you're going to go topical. But even you can step it up beyond that and go with the RDT and dissolve it into your mouth and under your tongue and get it right into your bloodstream. That's a lot more potent way to go. Probably 5 to 10 times more potent than other options. And so, yeah, that lady needs to switch or go talk to her local compounding pharmacist and find out how to help her doctor prescribe an RDT or even a capsule or a troche. I think a troche is kind of a not as effective version of an RDT, but it's still better than a capsule.
Does progesterone have anything to do with MTHFR?
Does progesterone have anything to do with MTHFR? So MTHFR causes a series of intracellular vitamin deficiencies, basically because when you have the MTHFR genetic error, it causes enzyme errors, and those enzyme errors lead to inabilities to absorb certain key B vitamins at a cellular level and other vitamins. And like I said, you can find out more in my book, which is free to download off Amazon. And please click on the thunderclap and help me with that. So those vitamin deficiencies in turn cause a reduction in the ability to make testosterone, progesterone, thyroid hormone, a lot of things. So these women kind of have semi-ovarian insufficiency issues or ovaries that just aren't brisk in what they're doing. Making hormones is like making bread. If you're low in yeast or flour, salt, sugar, your bread's not going to turn out. Making progesterone or testosterone or thyroid or other hormones is the same way. If you don't have B12 or folate or zinc or other key vitamins in your system, you're not going to properly make those hormones. So yes, it does.
What can be done to balance hormones for PCOS and on the mini pill? Or just hit part of that maybe.
Wow.
Overloaded.
Yeah, what can be, let me just cover, I don't like the mini pill. It's nothing mini about it. Still has the same risk of stroke, heart attacks, and breast cancer as a regular pill. It's just mini in size. So, what can you do for PCOS to balance? If it's really indeed PCOS, I rarely find that diagnosis has accurately been made. PCOS has a few gold standard diagnostic criteria. One is they have to have increased testosterone levels, massively increased insulin levels, and they're often mistaken for diabetics or diabetic resistant people. They're not until they hit menopause usually. And they're almost all hypothyroid, whether it looks that way or not. They'll give you the symptoms of being hypothyroid, and cold hands, cold feet, fatigue all the time, weight gain, and they'll all have very low progesterone levels. And so what you want to do is, the way I've always treated is give them a lot of progesterone. because it brings down their testosterone levels eventually, and it gets rid of their hot flashes, night sweats, their severe PMS. Then the biggest risk of cancer and by far of death for these women is breast cancer, especially postmenopausally. And so anything you can do to maintain really high progesterone levels with them for their entire lives makes them really happy and reduces their risk for breast cancer dramatically. Also, it will cause them to normalize their weight if they get enough progesterone. And it's just a great option. It's probably the best natural option. I usually don't put most of them on spironolactone or metformin. I know a lot of doctors do. I don't do that. I haven't found it to be that beneficial. But a lot of progesterone really changes the game for those women. So,
What about being insulin resistant with PCOS?
they are insulin resistant if they indeed have PCOS, and it tends to improve it when they lose the weight. And I also really encourage them to be super active, even if they don't feel like go out and walk 4 miles. I know 4 miles is a lot of walking every night. Lift some weights, do whatever they can. Take advantage of this incredibly powerful body they've been given. They're much stronger than most women and can do amazing things. It's an amazing, in some ways it's an amazingly beneficial problem to have, and others it's really hard for them. So
This is a hard question. It's been asked a couple times. Why would someone have normal monthly cycles but unable to conceive after so many years? Any thoughts on that, Dr. Person?
why would someone have normal monthly cycles and be unable to conceive after many years? That's just that's a loaded question. It could be that their partner is infertile, and that's a problem. It could be wow, so many issues. I can think of 20 or 30 right now that pop up.
Let's consider possibly this person is hypothyroid as well.
Well, if this person is potentially hypothyroid, that could be why she can't conceive. She needs to be on the correct amount of thyroid. Get my little book, No More Cold Hands, Cold Feet, and read it. It's cheap on Kindle, and read that. Deal with that problem appropriately. If your doctor's not dealing with it appropriately, find someone who will deal with it appropriately, because you're not going to get pregnant if you're hypothyroid. That would cause problems with the baby, and just all kinds of issues.
Same with Hashimoto's, right?
Same with Hashimoto's. It's got to be dealt with appropriately, meaning they need to be fairly aggressive with prescribing the thyroid medications.
Okay, so using birth control, is it true or not true to be using a progesterone hormone at the same time? Is that good or bad? I totally love that question.
I don't know. So can you use a natural progesterone while you're taking birth control pills? Yes. It's not going to change it. Not going to fix anything. Might offset some of the breast cancer risk and some of the inflammation the birth control pill causes. So yes, could be very beneficial for some women. Why not? Try it. It can't hurt. It won't increase your risk for getting pregnant while you're on the birth control pills. That shuts down your ovaries. There's, nothing's going to stop that.
So if you're using compounded progesterone or progesterone and you're still having heavy bleeding, like your body's trying to cycle every week, what would you do? What should
If you're using compounded or natural progesterone and your body's still trying to cycle heavily every week, you need to either double or triple or quadruple your dose of progesterone and try and shut it down. You need to make sure talk to your doctor about an IVUS, intravaginal ultrasound. Make sure you don't have a polyp or a tumor or cancer or a fibroid. Probably a fibroid, if I had to guess. Often is. And those are called leiomyomas too. I think in Australia and other countries they call them that. So there's all kinds of possibilities there. But someone needs to examine, evaluate, maybe do an ultrasound, see what's going on. So.
Okay, do you want to wrap it up or?
Yeah, let's. Why don't we do one more question?
Okay.
Hope this has helped. Hey, and don't forget, if you're still curious and want to know more, get my course on this. And next month, download my book. Do my thunderclap, please. This week, hit my thunderclap tonight. Wow, that'd be awesome. While you guys, it's free. It's super easy. Take you 3 seconds to do it on my Facebook page there. Just click on it and then choose which way you want to go and share about MTHFR. Hey, my book is free. I'm not trying to make money off that. I'm just trying to get the word out there. So
where do we find the course?
look at the website, the URL on the bottom. Where do you find the progesterone course? Super easy. Yeah, progesterone.drpurser.com. Wow, I blew that. Okay. Progesterone.drpurser. Sorry, let me do it again. Progesterone.drpursercourse.com. Okay.
Okay,
I need to change that.
here's a good one, a complicated one, but kind of fun to
Okay,
talk
last
about.
question.
I have been diagnosed with an adrenal fatigue, depleted neurotransmitters, all of them, MTHFR, low progesterone, and I've been on progesterone for a year, and that is up and great. But could the fact I was so low in progesterone play any role in any of the other issues going on?
No. Yeah, the other issues, again, back to MTHFR, you're going to have those severe vitamin deficiency. If you haven't done a SpectraCell, hey, that person needs to, whoever asked that question, get my book, read it, it's super easy, and you need to get a SpectraCell comprehensive micronutrient panel and just see what all you're depleted in. And you need to hit those vitamins correctly. And you may not need the progesterone according to your age. You may start dialing in and making all those hormones on your own adequately when you get the right vitamins in. You got to picture MTHFR as a brick wall, and with these people are like a brick wall with bricks missing. That's caused from the genetic errors that they have and other errors that we all have in their genome. And when they have those genetic errors, it causes vitamin deficiencies. And so the job of someone who designs vitamins, and I've designed a couple lines of vitamins for MTHFR for various companies, and you see some of my hands and some products that some of you are using now. And so, but when you design those vitamins, it fills those holes in that brick wall as best you can, and you can get back to about 97-98% of what you should be doing and haven't ever done your whole life. That's the beauty of treating MTHFR appropriately, including you making adequate amounts of progesterone, thyroid, testosterone, everything you should be making. That's the theory. That's how it works. I've seen it work. And if you treat it correctly, MTHFR, wonderful things can happen. Go ahead.
Does your book address needed items from seniors all the way down to teenagers?
Yes. The MTHFR, the progesterone book.
Progesterone.
Yes, the progesterone book does all that. It's been number 31 on Amazon. Number 31 out of 40 million books. It's the number one healthcare book out there at the time. This has been the number one healthcare book the last few weeks. The number one medical book on Amazon was in the top 100. Made it to 81 out of 40 million books, and I'm giving it away free now. So watch for my progesterone book. It'll be next, and so thunderclap it next week, and on the 1st, August 1st. And I love all you guys. Thank you. You know how much I love you. I really appreciate it. Yeah, so next week, I'm going to teach you about, you heard someone whisper, next week, I'm going to teach you about estradiol and the benefits of estrogens. For women, you got to hear that, especially all you women who are approaching menopause or have low ovarian function. And but download my MTHFR book if you haven't, and thunderclap it, please. Okay, I love all you guys. Take care. Go in good health, and God bless.